So as we get started, the reason we named this the Heartbreak and Cost of Isolation Strategies for Coping During the Pandemic is simply because of what we actually have seen ourselves here at the West Center. Not only the effect that this pandemic has had on residents, but also the effect that it has had on family members and professionals who work in the field. So that is why we put this together. So here's our course description for those of you who are going to be getting the CEUs. And here's our objectives. So isolation. Isolation is difficult for everybody. I was standing in Sam's last night and I had a woman just start talking to me. I actually still had my name tag on, and she started talking to me and telling me how hard this has been on her. I find that happens a lot whenever we have our name tags on and we go out in public. People do approach us and start to talk to us about things that are going on in their families, because everybody knows someone who has dementia. But isolation is difficult for everybody. And if you're someone who's already prone to depression or anxiety, it can be even more problematic. The other thing that we tend to do when we're isolated is we tend to ruminate more than we do at other times, because we're alone with our thoughts. And that can be one of the worst things for our mental health. We know that solitary confinement in prison can be lethal for some people. So when we're told that we have to be kind of shut down and alone with our own thoughts, that can be detrimental to our mental health. We're made to be social people, and it's natural for us to want to connect with others. And at the beginning of all of this, we were really having to get creative and finding out ways to try to stay connected. So here are some of the statistics that have come out recently, and they are staggering. There's a reason I put this in red. So according to the Chief of Mortality Statistics at the CDC, deaths attributed to dementia rose more than 20% above normal over the summer. So to break that down a little bit, 61,000 deaths between June and September, which is up 11,000 from the same time last year. Year to date, there are over 26,000 extra dementia deaths this year, and these are people who did not have the coronavirus. So what's the link? There's definitely a link to the virus, even though these folks did not have the virus. The increased isolation and the stress during lockdown were definitely contributing factors, and we're going to deep dive more into those. So the federal efforts to address nursing homes amid the pandemic have been too little and tragically too late for many. Even as we're starting to open back up now, a lot of the damage is already done. So long-term care, again, has not been a priority, and residents and families are suffering from the isolation, are continuing to suffer from the isolation. And we're going to talk about some of those reasons. PPEs and testing being in short supply, but they're mandated. And so it's kind of a catch-22 where you've got to do this, but how do you do it, and where are the supplies to be able to do it? But advocates are pushing for and wanting families to be able to visit their loved ones in the nursing homes, but we've got severe restrictions to keep the virus from spreading. However, the isolation and the stress worsens dementia. Being isolated and being kept away from our loved ones worsens dementia. But if we start bringing people in too soon, you can see where you can get just caught in this spiral. So some more of the cost of isolation. Residents across the country are having significant declines in weight, social abilities, and communication since the onset of the shutdown. And that is part of what we're going to talk about today, is when we are able to get in and to finally see our loved one again, we may be expecting them to be exactly the same as they were 7 or 8 months ago, but we are 7 months further into a progressive disease. And so these are just some of the things that we're seeing across the board, and this is nationwide. And I get emails from people all over the country. I had an email from somebody from Pennsylvania last week that said they're shut down again. Their families can't come in again. And they're starting to see this big decline again. The first one she mentioned to me was weight, that residents are losing weight. We're going to talk about some of those reasons. Just the social abilities, being able to have that banter or the chit chat back and forth, because long-term care facilities and assisted livings don't have staff to do one-on-one. But when families were coming in and they were being able to see folks every day or every other day or even just once a week, they were being able to communicate and work with their loved one. And then family members are becoming literally heartsick over not being able to see their loved ones for months. There really is something called a broken heart syndrome. It's a real thing. And we're seeing that happen where people are reaching out and saying, you know, my father, who's been married to my mother for 50, 60, 70 years sometimes, this is killing him to not see her. And it is. It literally is. We know that having the families back in the lives of the residents in person brings joy for all. Many people with dementia don't understand FaceTime or phones. And so we have some residents who have not even been able to utilize that as much as the family wants to do it. If they don't understand it, sometimes it can actually cause more stress. So here are some of the new statistics that I just added yesterday. And this is from our friends at the Rosalind Carter Institute. They did a Caregivers in Crisis report, and this just came out yesterday, October 2020. And here's what they found in a poll that they did. 83% of caregivers reported increased stress since the beginning of the pandemic. 42% reported a decrease in available help and support, increased isolation, concerns about financial stability, and a debilitating impact on their overall mental and physical health. So why is that happening? This caregiver burden and stress is impacting caregivers across the United States, and it's impacting their overall wellness as well as depression and anxiety. And then I grabbed this last bullet point straight from the Rosalind Carter Institute and what they said, because they are all about taking care of caregivers. If we do not begin to seriously address the needs of caregivers and provide the necessary supports, this indispensable, largely invisible component of our healthcare system is in danger of collapse. That is powerful. That's our unpaid family caregivers. Again, according to this report that came out yesterday from the Rosalind Carter Institute, that RCI is Rosalind Carter Institute, the caregivers express the need for more, and these are some things that have been taken away due to the pandemic, due to the shutdown. Respite and day programs, social interaction has completely changed, peer support and self-care, financial assistance, clinical and in-home care services. And as I was reading through that, some of the financial assistance that has been available, it's like that group has been forgotten, that group of at-home caregivers who still have their loved ones there with them. They haven't been able to get any type of extra help during this time. So reasons for the increase, why are they seeing so much more stress? They've got more responsibilities now due to the increased health risk that's going on. They're worrying about themselves, they're worrying about their loved ones getting the virus. They're also having delay in medical treatment. For the longest, they weren't able to get into the doctor. And now when they can get in, I had somebody tell me there's up to a 3-month wait to get in to see the doctor, and they already haven't seen him for months. Everything from the physician to the dentist to the eye doctor to all of these different specialists that they're needing to see, and they're having to wait to get in. So that is increasing the stress. It's also difficult to take a break when you can't leave the house. So if you were used to being able to taking your loved one to an adult day program or using some respite or even having someone come and provide you some respite, and now you can't. And one of the things that we talk to caregivers about all the time is making sure to take time for yourself. It's hard to get away when you're just in the house. So a decline in the health of the care recipient leads to an increased caregiver burden and stress. And we find that that leads to a decline in the health of the caregiver. One statistic I did not put in here and should have, because we say it over and over in our caregiver programs, and I'll be interested to see how this statistic changes this year. 68% of the time, the caregiver passes away before the care recipient. 68% of the time. What's going to happen to that number this year? So this number is that 55% frequency of contact with the loved one who lives at home is up 55%. And that's simply because they're not able to take them out to adult day programs or to have respite services come in so that they can leave and get a break. And of that 55%, 92% reports an increase in stress due to caregiving. So almost everybody. Good thing, 57% of caregivers are now using the internet for some type of support service, and we have sure seen that grown. We've even had to add a support group, like Jamie was saying, where we have 2, and after the first of the year, we're actually going to add a 3rd one. We're going to add one on a Saturday. So that's the good news, is that we are starting to see people learn how to get support online. And we've actually been able to reach folks that we wouldn't have been reaching before by doing our programs online, because they can't take their loved ones to a day program while they come to the support group, but they can maybe get off in another room or get their loved one busy with something. Pandemic conditions have led to an increase in behavioral issues in those with dementia due to their routine being changed. So people who had not seen very many challenging behaviors are now all of a sudden seeing some pretty challenging behaviors. And when they start talking about and looking at, okay, what changed? It's the pandemic, it's the isolation, that's what's changed. Their routines have changed. So reduced access to the care recipient. Anxiety has led to a decline in interaction with other family members as well. Whenever we are under a tremendous amount of stress, many times we will take that out on the ones that are closest to us. That's kind of our safe, those are our safe people. And we'll have that short fuse with those that are closest to us. And people are reporting higher levels of anger and frustration with each other, and even having that short fuse. And we're going to talk more about what is that anger actually? Where is that anger coming from? Because in counseling, we talk about anger is actually the easiest emotion that we have. Depression and anxiety levels are high for those whose loved ones are placed due to uncertainty. So when our loved one is placed in a facility and we haven't been able to get in to see them, or all we can do is see them through a window or through FaceTime, and we can't be there, we can't touch them, we can't be in their presence, increased depression and anxiety. So look at this statistic. Prescriptions for antidepressants and anti-anxiety medications are up 34%. And then this one is also a new October 2020, because this one has gone up since we did our program last. According to MarketWatch, alcohol sales are up 41% in women and 54% in men. When we first started doing programs similar to this, that was down. That was about 32, 34%. And now it's up to 41 and 54%. One of the articles I was reading yesterday was quoting a woman who said that alcohol was an acceptable way of dealing with stress and anxiety, and because she was finding herself purchasing more alcohol. So what's happening to residents? And there's several theories and ideas about this. One of them is that families, when families were coming in, especially with those with dementia, we encourage families to bring in cookies, bring in sweets, bring in a shake or a malt. And that's not happening anymore. They also were assisting with mealtime. They would be up here. I know we had folks here that would be here 3 times a day, helping to assist at mealtime. And again, there's no place, there is not a long-term care facility or an assisted living that has one-on-one, so they can sit with every single resident and make sure that they are eating everything. Everybody's doing the very best that they can, but there's stress over seeing everyone in PPEs. This is interesting. I had someone send me an email and she said she finally figured out what was going on with her mom with the mask, because she was starting to have some pretty challenging behaviors in her care facility. And her mom finally told her, she kind of whispered it to her, that there were a bunch of bandits running around. She was associating someone with their face covered. She even used the word robber, that it was robbers and bandits, that it was bad guys because they had their face covered. Now, to have to explain to somebody with dementia who can't be reasonable or rational that this is because of a health concern. What she was seeing was a bandit, and she wasn't going to eat with bandits around. Wow. A lot of places also are short-staffed right now, or are having to use universal workers. And what a universal worker is it may be the same person providing care who then is also doing engagements or activities, who is also doing the laundry, who is also serving the meals, who is also, so a lot of places have universal workers. Whenever you've got universal workers, of course you're not going to have as much one-on-one time with the residents. And then everybody has had changes to their routine. Changes to the routine are extremely stressful for residents with dementia, their families, and for professional caregivers. And this is where we get into compassion fatigue and burnout. Compassion fatigue and burnout can happen with professional caregivers as well as family caregivers. Compassion fatigue is exactly what it sounds like. You have hit the wall physically, emotionally, spiritually. You just don't have any more to give. You've given all that you can give. This is very common in those who take care of someone who is terminal. Think about caregivers in other fields where people are receiving treatments. So there's that hope that they're going to get better. We're going to try this new medication. We're going to try this new radiation or chemotherapy. When you're taking care of someone who is terminal, we don't have that option. And so compassion fatigue and burnout are already very high in the field of memory care, but during a time like this, we really see a lot of it. And the residents pick up on emotional changes, and they pick up on tone and gestures and body language, even if you're in a mask. They can pick up on all of that. So what can we do if our loved one is placed? One of the best things that you can do is to send care packages to your loved ones, send care packages to the staff, have handwritten notes that you're sending. We've got 2 walls that are filled with handwritten notes that we've had from family members, and I will see our staff members standing and just reading those notes. It makes them feel fantastic. We even have an Amazon wish list here at the West Center where our families have been sending treats, and we were able to put care packages together for our staff and send those home. But again, those handwritten letters and notes, FaceTime with your loved one as often as you can, sending photos and books with captions. So what I mean by this is at places like Walgreens and CVS, you can take your photos and turn them into a storybook. You can do it online. Now, the pictures you're going to want to be sending to your loved one, we want to send them pictures of our grandkids, but that's not the pictures they need to see. They need to see the picture of themselves when they were young, pictures of them with their brothers and sisters, and then label it down at the bottom if you create this book or if you make copies of photos. And remember to label it with who they are to them. So if it's their aunt and uncle, make sure you put on there Uncle Stephen, Aunt Catherine, who they were to them, mom, dad, and use the words that they used. If they called them mama or if they called them daddy, use those words on those photos. Write and call your state officials. We are continuing to push everyone to do that, and then pray and keeping the faith as well. So let's talk a little bit about what is this that I'm feeling as a caregiver. When you see your loved one for the first time in 7 to 8 months, you're going to be overcome with some feelings and emotions that may surprise you. And we have seen this happening in the last several weeks and are doing our best to really take care of our family members here. And you may go in thinking that you are just going to be filled with joy, but the reality is that another form of grief is going to come along with this. And what that grief is the grief over the loss of these 7 to 8 months and the changes that have happened over the last 7 to 8 months. And we have to recognize that, and we have to call it what it is. Our loved ones are 7 to 8 months further into a progressive disease. They have changed. That is a guarantee. People with dementia tend to change about every 6 months, even if it's just the normal progression of the disease. We see changes about every 6 months. They're not going to be the same as they were in March. They very likely are not going to look the same, and they're not going to act the same. And the biggest fear I think that I am hearing is, are they going to know who I am? So you are very likely going to have a flood of emotions. And when you see them for the first time, if there are tears, that's great if there's tears. But what we want to say to our loved one, if they ask us about those tears, is that we're just so happy to see them. We're so happy to see them, and really not mention time. Because it would be easy to say, well, it's been 7 months since I saw you, that's why I'm crying. Keep in mind, they don't have this concept of time like we do. They may tell you it's been 2 weeks, or they may tell you it's been 7 years, because they don't have the same concept of time. So just don't bring up the time. And then we use those therapeutic stories that we're used to using for people with dementia. I'm just so happy to see you. I'm crying. And please, 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 if you get nothing else out of this entire program today, please get this. Don't ever ask somebody who has dementia if they remember you. Don't try to test their memory. Don't ask them if they know your name. You're setting yourself up to get upset. You're setting them up to get upset. We talk about having big hellos and little goodbyes. So as you come in, have that big hello and call them by their relationship to you. So if it is mom or dad or aunt or uncle, if it's your husband or your wife, use that pet name, sweetheart, honey, sugar, whatever it is, big hellos. That's going to trigger them also, because you're using that name. And then I put this in bold and underlined and in red, because when we did this with our family members, we mentioned this, and we have had this brought back up to us in the support groups, that this was one of the best things that we told our family members, so that when they came in, they had something to do. Because as our loved ones are coming back in to see their family members, we're trying to keep them, of course, over in an area together, in their rooms together. And what they found is that they were sitting there looking at each other. And so we were saying, bring something in, because you may not be able to just sit there and have a conversation with somebody with dementia. So bring in their music. Most everybody has these iPhones now. Download their favorite music. It might not be your favorite music, but it needs to be their favorite music, or music that you shared together in the past. That's actually one of the best things that you can do. And you may find yourself during your visit, your whole visit may be sitting and listening to music. That's good. That's a good visit. And you may be able to sit and pat your hands together, or reach over and pat together, and have that rhythmic that people with dementia love so much. Bring in some pictures. I wouldn't bring the originals. Again, go and make some copies of things, but bring in pictures. Now, pictures on the phone are hard for a person with dementia to see. An iPad works better. I actually had a family member tell me that she brought her computer in so that she was able to pull up some pictures on a computer. But bring in some pictures, or have some fun videos. You can go to YouTube and pull up funny animal videos, and you will catch yourself enjoying it just as much as your loved one whenever you are watching little baby goats or little baby ducklings. Another thing is to go in and put videos of children laughing, babies laughing. Those are wonderful things to do with somebody with dementia. Come in and bring the cookies, bring the ice cream, bring the candy. Now, you're not going to be able to sit there and share that with them, because we've got to keep our mask on, but you can certainly give it to them and allow them to have it. Now, I do want to add this. I had somebody do that last week. She brought in her husband's favorite candy, and she said, Holly, he didn't want it. It wasn't his favorite candy anymore. 7 months ago it was, but now it isn't. So be prepared for something like that to happen as well. She gave it to the staff. She's like, I just passed out candy to the staff. But understanding, again, that's part of that. That was something that surprised her, that There's been change. Items they might know. It might be a quilt. It might be something that might be familiar to them from their past. Bring that in. Also keeping in mind not to say things like, so what have you been doing the last 7 months? That wouldn't be a good question for somebody with dementia. This is where we're just going to walk in and lead that conversation, bring them with us. Now, here's some other things to be prepared for. Be prepared for them to walk away or to fall asleep, because that may be something that happens. We want them to stay. We want them to be there for that entire 30 minutes or 1 hour. But this is where we have to keep in mind, we accommodate the disease, they can't. We're going along on this journey with them. We accommodate the disease, they can't. A 5-minute visit may be fine for them. That may be all they want. You may have to work into a 10-minute and then a 15-minute visit, and that is okay. Even if they fall asleep, you can sit there and be in their presence. You can be playing music for them. And then give yourself that permission to leave. Just because it was scheduled for an hour, that does not mean that you have to stay for an hour. And it is okay to come back and try again on another day. We were doing that before the shutdown, where some days you come in and go, well, we're just not having it today. Today's not a good day. And you come in on other days and great, we're having a great day. Again, we accommodate the disease, they can't. They may be perfectly fine with the visit. And the other thing that could happen, it might happen, is that they might get upset. But again, if you think back, that probably had happened before. I've sure had family members come and go, they just told me to leave. They just told me they were busy. They just told me they didn't know who I was and they didn't want to see me. And I tell them, you know what, go get you some coffee and come back. Let's try it again in just a little bit. Give them time to kind of reset or to get busy or to do something else. That may still happen. What we need to do though is we need to focus on the present and we need to focus on quality of life. Remembering that whenever you're visiting your loved one, you can't take your mask off, but you can smile with your face and with your eyes. They're going to pick up on your body language and your tone and your gestures. You're going to want to make sure and speak up because you'll be muffled because of the mask. Look them directly in the face and think about before you go in how this might affect you. I'm so glad that everybody's on here today so that you can be thinking about ahead of time how this might affect you and how your loved one might react. And then we always encourage you to join a family support group and to continue to educate yourself about the disease. So let's talk a little bit more about self-care, and we're going to go a little further into some of those emotions and feelings that you might have. And there's been a lot out about self-care during the pandemic, but what I did is I went through and I did a lot of research on caregivers, and I broke it down to 5, just kind of the top 5 things that we could do to take care of ourselves. So the practice of taking an active role in protecting one's own well-being and happiness, in particular during periods of stress. And then here's coping skills. Refers to adaptive coping strategies which reduce stress. And then I added there constructive coping strategies because there are certainly destructive coping strategies. We want to stay away from those. But where did we learn our coping strategies? We usually learned them from the people we grew up with and the people we grew up around. And if you think back to that, that could be good or bad. You know, we may have watched a parent cope in a way that wasn't a healthy way, and hopefully we have found a different way of coping. But we learn and develop negative coping skills. We can learn to turn what would just be a normal, regular, day-to-day stressor into a catastrophe. And there's a term we use in counseling called catastrophizing, where we turn everything into a catastrophe. That's a negative coping skill. But positive coping skills allow us to become more resilient, and they allow us to become more resilient in the face of a challenge, including those fears of anger, anxiety, and depression. So we have seen this many, many times. You can't pour from an empty cup. Take care of yourself first, especially those of you that are professionals. If you're social workers, if you're counselors, if you're nurses, you work in the medical field, we can preach this to people all day long. Are we doing it? And those of you that are family caregivers, I bet if I asked you, what are the things that you should be doing to take care of yourself, you could probably just spout them off. But are you doing it? That's what it gets down to. We're talking a lot about this in the support groups right now and challenging people. Change one thing, and then let's come back next week and see if it's made a difference. And Jamie and I, since March, have heard people over and over and over and over say, I changed this, and this is what, and they're having positive results. So ways to stay healthy during the pandemic. And again, I took it down to the top 5 that I could find. And this one, and I think the closer we get the next couple of weeks, we really need to avoid information overload and limit our screen time. Only watch or listen to trusted sources. It's to the point right now, I don't even want to have the TV on, or I want to be able to zap through all the commercials and not even look at any of the commercials that are on. Disable your news notifications or have a set time to look and listen each day. Otherwise, that phone may be dinging all day long, and that is the last thing we need. I've even suggested that people uninstall social media if it's causing you to become too anxious. If people and what they're posting on Facebook or any of the other social media outlets is making you anxious, uninstall it for a while. Turn off the notifications. I moved it to a page on my phone where I can't see it. So I don't know how many notifications are on there because I can't see the thing. Try to schedule 1 hour every day with no screen time. Just 1 hour. Sit outside, listen to nature, listen to music. Start to become comfortable with silence. We live in a society where we try to fill silence. In fact, in counseling, we call that an uncomfortable silence sometimes when we're talking and we just sit there and let it be quiet, because it makes people really uncomfortable and they'll try to fill that void. So try to have some time where it's just quiet. Go sit outside. Screen time. Try no screen time for 1 hour. So this is going to talk about that anger that some of you may be feeling. When we accept the reality of the situation and we name our feelings, we can then tame our feelings. When you name it, you can tame it. So what are some of the feelings that you are having right now? And I've just listed some of the ones that we've heard over and over. Is it anger, fearful, mad, disappointed, scared, frustrated, insecure, weak, bored, stressed, tired? Acknowledging an unpleasant reality may help you reduce your stress and clearly think through your feelings. What are you actually feeling? And what we have found is that when people are angry and they go to anger first, when you get down to it, it is usually fear. It's fear of something. And when all of this started, in fact, on our very first support group, we had somebody back in March who said, I am just so angry. I'm mad at everybody. And before the hour was over, she was saying, I'm scared. I'm afraid. I don't know what's going to happen, and I'm scared. And it's easier to be mad. It's easier to be angry than to say, I'm scared. This feels like I'm out of control. But she named it. And then you can start to work on it. And then you own that. I'm scared. I'm afraid. And realizing we are not going to be happy all the time. Nobody is happy all the time. That's okay. This hasn't been a real happy time. But acknowledging uncomfortable feelings gives you power over those feelings. And acceptance places power in your hands. It indicates that you realize the change and you're choosing to lean into the change rather than run from the change. Share those feelings with people you trust. Write them down if you need to. A lot of people find journaling really, really helps. And if it's something that you don't want to keep around, write it down and put it through the shredder. Write it down and take it out and burn it. Write it down. I've sure had people write things down and release it on a balloon, just releasing those feelings away. And then this, it is okay to have feelings right now that are not normal to you. This is not a normal time. So if you go, usually I'm really optimistic and I don't know why I've been so mad. I've had that short fuse. This isn't a normal time. It is okay for you to have feelings that are not normal for you. Don't feel guilty about those feelings. Don't think of your feelings as positive or negative either. They're just representing what you're feeling at the current time. This isn't a normal time, so why would you have normal feelings? Another thing you can do is to use this time to get to know and understand yourself better. And I'm seeing a lot of people start to do this on the sites that I'm on with counseling sites, where they're turning those feelings that they have and they're being creative with them, and they're turning them into poetry. They're turning these feelings into songs. I saw a place where people are writing books or writing stories to leave for their grandchildren about the year 2020 and all that was going on with them. It's really interesting what people are starting to do with their feelings and emotions during this time. Use that and find a creative outlet for it. Another thing we can do is we can tackle the task that we've been putting off. We sure can't look back on this year and say, well, I didn't have time to get to that closet or to clean out that garage or to rearrange the furniture. Finish those books you've been meaning to finish and you just hadn't had time to read. The third thing is thinking outside of yourself, helping other people, and allowing people to help you. Think about how good it feels whenever somebody allows you to do something to them, when you take a meal to someone, when you deliver flowers to someone, and that feeling you get when you give to someone else. So most people actually love to feel included and appreciate being thought of. So allow them the satisfaction of helping you, and then you pay it forward and turn around and help someone else. It always feels good to contribute to the well-being of someone else. So reach out to seniors in your church or at a nursing home. You don't have to have someone in a nursing home to drop off cookies or to drop off handwritten notes of thanks, or to go by Sam's and bring a great big thing of prepackaged treats and leave them at a nursing home. Write letters, send cards, take cookies, etc. Make a meal for someone and drop it off at their home. Take a plant or flowers and leave it on their doorstep. I've heard some of the most creative things that people are doing right now to reach out to others. One that comes to mind is somebody who said that she got out a church directory, and every week she's trying to touch base with 5 people in that church directory. And it may be people she hadn't talked to in a long time, but she's just reaching out and touch. Are you doing all right? Can I get you anything? I'm going to just touching base with them. And from that, she was telling us that she now has somebody that every night at 9 o'clock, they have a check-in phone call. It may just be a couple of minutes, but it's just a little check-in phone call every evening. The fourth thing is seek support wisely and staying connected, and choose who it is that you talk to about your fears and what you have going on. Family, friends, support groups, church, etc. Having daily friends with daily check-ins with close friends and contacts, and making a list of people to call, text, video chat, or send notes to, and challenge yourself to do that. If not every day, every other day, or have this list of folks I'm going to reach out and see if I can visit with. Somebody else told me that they had started sending messages to people on Facebook that they hadn't talked to one-on-one for a good while, and they ended up creating a room specific to this group of people who had graduated together many, 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 many years ago, and now they've got their own little personal room where they're chatting and hanging out, all because of this during this time. And the fifth thing is being able to focus and continue to have a routine yourself. And these are some of those things that we all say, oh, I know I'm supposed to do that. But again, are you doing it? Drinking plenty of water, because we heard what people are drinking a lot of. Alcohol sales are way up. So are we drinking plenty of water? Are we eating healthy? It's really easy to drive through or to have Grubhub come and deliver it to our house. Doing yoga and practicing mindfulness. These are things. We've got a Stress Less with James L. West that we do every Monday at 1 o'clock. And we've been going through, and just for 30 minutes, we actually do a stress reduction technique on Zoom with everybody. But you can go to YouTube and you can Google, you can put in beginner yoga, beginner mindfulness. There's also a lot of apps. I sent an email out earlier this week that had 8 or 10 different apps on it that are free, that can kind of talk you through things like guided imagery. And then being able to recognize physiological sensations like elevated heartbeats or palpitations. We tend as caregivers to get these a lot when we lay down at night. And most of the time, if you will use positive self-talk, you can allow them to pass and neutralize, especially if you know, if you've been checked out and you know it is not a cardiac issue, if you know that it is anxiety. We're trying to kind of shut our mind down to go to sleep, and that seems to be right when the switch turns on. So starting to use that positive self-talk, and also progressive muscle relaxation is a really good thing to use at night when you're trying to go to sleep. That's another one you can look up, progressive muscle relaxation. There's an app for that also. It's called PMR. Making sure that we're getting enough sleep. And then doing cognitive exercises or brain games. So doing those easy crossword puzzles that you can do while you're watching TV, that's probably not the ones you need to be doing. You need to be doing the ones that are challenging. If the easy ones are too easy, push yourself to go to that next level. Do the medium crossword puzzles. Switch over and do some word searches for a while. Another thing that's really good for your brain is to start using your non-dominant hand. Sounds pretty simple. I can text now almost as fast with my left hand as I can with my right, because that was the thing I challenged myself to do. Just brush your hair with the non-dominant hand. Those are easy. Sweep the other way. Try doing some of those things. It's really good for your brain. Avoid binging anything. During this time, we've been hearing lots of binging, Netflix binging, alcohol, food, Amazon shopping, TV, Facebook, binging of any kind. Try to avoid binging. And then work on a hobby or skill. You can go on YouTube and pretty much figure out how to do anything. How to speak a new language, try a new language. Play an instrument maybe that you haven't touched in years. That's been something we've heard a lot of folks tell us, you know what, I dusted off the guitar. I sat down at the piano again. Those things are great for your brain. And all of that is going to help you be in a better mood and going to help with your emotions as well. Learning to knit or crochet. We've had folks tell us that they're teaching themselves how to crochet, or paint or draw, anything that is kind of, especially if it pushes you out of your comfort zone, good for your brain. Write or mentally recite a gratitude list once a day. This is another good thing to do at nighttime when you are starting to lay down, is to think about, find the good things. The sun came up today. It was a beautiful day. I sat and listened to the birds. I saw a cardinal. I did those small things. Find those small things. And also getting dressed for a typical day. Whether you're going to be leaving or not, getting dressed and getting ready for a typical day. We have people who tell us that they put on their makeup and their jewelry specifically for support group. And a lot of people will even show me, look, Holly, I've got on my earrings today just for support group, because it's a reason to get up, get dressed, put our makeup on, and put our jewelry on. And then making that realistic schedule and sticking to it is important also. And then here's the big one. I always save it for last because people are, oh, exercise. But I love this cartoon. What fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? I think that sums that up. But research shows us over and over and over again that exercise is the best coping skill that anybody can develop. So are you doing something to move a little bit more? And this does not mean you have to be doing jumping jacks or running around the block. It may just mean that instead of going out to the mailbox once, you go out to the mailbox twice. You walked a little bit more than you did yesterday. And that would be my challenge, is to try to just do a little bit more today than you did yesterday, and do a little bit more tomorrow. Do things during commercials while you're watching them. Get one of those 5-pound weights and sit there and lift those 5-pound weights. Get one of the pedalers, and you can sit and pedal your arms, or you can sit and pedal your feet during commercials of your favorite show. Something little, but you're moving. Here are some local resources, and there are a lot of resources online, but here's some local ones. Our friends at Educate, Dementia Friendly Fort Worth, and Dementia Friendly Fort Worth right now is doing a daily activity for people with dementia. As a matter of fact, one of their, I know that I've got some people who come on the support group who have their loved one doing the activity in the other room with Dementia Friendly Fort Worth while they're on with me in the other room doing support group. So they work at the same time. The Alzheimer's Association has a lot of programs out right now, and then the Fort Worth Library as well. Here's our information where you can reach me, you can reach Jamie. And like she said, we'll be sending these slides out. I did want to leave time for any questions or to see if there was anything that was put in the chat. Jamie?
There was a question at the beginning. You mentioned we're 7 months later into the disease. How much more has the separation diminished a loved one's capacity?
Yeah.
Can you speak to that?
And that, again, with this being such an individualized disease, where it's different for everybody, but we are seeing changes across the board. Everybody has had some changes. I know from what I'm reading, from what I'm seeing, just kind of nationwide, there's been where people can expect to see like a 10 to 12 to even 15-pound weight loss in their loved ones. And again, this isn't everybody. This is just in some people, a lot of people. Where they're seeing changes in communication skills. So, you know, what I'm reading, what I'm seeing is what we would have normally seen in 6 months. It's almost like it's more like a year. So maybe double what we would have seen, probably is the best way to look at it. And again, it's not everybody. It also depends on where were they when it started. Were they mild? And now maybe they're moderate. Were they moderate and now maybe they're moving closer to severe? Have they had something happen? Have they had a fall? Have they had COVID? Have they had pneumonia? Have they had a UTI? All of those things that will accelerate the disease anyway. If you add that on top of the isolation, then we are seeing a decline. So unfortunately, that's what I'm gathering, is that it's almost like it's been more like a year. But what we're hoping to see, and I can tell you because I've seen this with my own eyes, is as families have started to come back in, we have seen people start to reverse and pick up the spoon again where they were just eating with their fingers, start to have smiles and start to have their communication skills are a little bit better. So, you know, you also have to wonder how much of that is depression, anxiety in the resident. So that's one of the things, is as we are starting to open back up, I'm seeing it, absolutely seeing it, the changes in the residents. Oh, good, good, good. Move the computer mouse to the non-dominant hand. That's excellent. Let's see, I'm looking through here.
Really not a lot of specific questions, just sharing.
Okay, great.
Yeah, the outdoor spaces in the sun for the vitamin D.
Absolutely. And that's one of those things, if your loved one is placed somewhere where you might be able to sit outside with them, sometimes that's all you have to do is let's just go sit outside, and I brought this candy or these cookies, and I'm going to put this music on, and let's sit here and look at the birds or look at the flowers or just sit in the sun and close our eyes. That's quality time right there, being together. Did anybody have anything else? Any comments, questions, anything that you have experienced yourself? Well, I added slides and actually finished earlier because I wanted to make sure and leave time. Thanks, everybody. Well, Jamie will get this sent out, like we said, and please share this. Like we're having people reach out to us and just needing this information. It's so important to know, kind of have an idea of what to expect when you do go in to see your loved one for the first time. But also, I think just that being able to name your feelings, tame your feelings, own your feelings, and know that it is okay to have feelings that aren't normal to you during a time that isn't normal. All right, Jamie, can you think of anything else?
Just always feel free to reach out to us at any time for any questions that you maybe have that are general or specific to your particular situation. We're always available. Please visit our website. We have a list of our upcoming programs, but we also have our JamesLWestLearn.org platform, and there are some caregiving videos on that platform, as well as timely blogs and podcasts that you can access at any time, and also our YouTube channel. We do record a lot of our programs, and we download them to our YouTube channel for people to access anytime, and also share with those that you think need this information. Again, email us at caregiver@jameslwest.org for your free CEU if you would like that. I believe that's it.
All right, and on Mondays at 4 o'clock, we do a Facebook Live where we answer questions. And so if you're interested in that, or if you think of something else, you can always catch us on Mondays also on Facebook Live, or you can send us a question and we'll answer it live on Facebook. Because if you've got the question, I guarantee you other people have the question. All right, well, thanks everybody. It was good to see you today. Bye-bye.